Welcome to this module on nervous disorders. In this video, we'll provide a comprehensive overview of neurological conditions that affect the nervous system. Nervous disorders, also known as neurological disorders, affect both the central and peripheral nervous systems. This includes the brain, spinal cord, cranial nerves, peripheral nerves, nerve roots, the autonomic nervous system, and the neuromuscular junction. These structures are essential for sensory input, motor control, and vital functions, making their diseases complex and often debilitating. Nervous disorders are broadly classified into two categories based on the part of the nervous system they affect. Central nervous system disorders include stroke, epilepsy, multiple sclerosis, Parkinson's disease, Alzheimer's disease, infections like meningitis and encephalitis, and brain tumors. These conditions affect the brain and spinal cord, often resulting in widespread and serious neurological symptoms. On the other hand, peripheral nervous system disorders affect the nerves outside the brain and spinal cord. Common examples include Guillain-Barré syndrome, peripheral neuropathy, myasthenia gravis, and brachial plexopathy. These typically cause weakness, numbness, or muscle fatigue in the limbs or face. Neurological disorders can present with a wide range of symptoms, depending on the part of the nervous system involved. Common signs include headaches, muscle weakness, and loss of coordination. Some conditions may lead to seizures, numbness, or tingling sensations. Others may affect memory, speech, or vision. In more severe cases, paralysis can occur, highlighting the importance of early diagnosis and intervention. Nervous disorders can arise from a variety of causes, often classified into several categories. Genetic factors, such as those in Huntington's disease, play a key role in some disorders. Infections like meningitis can directly affect the nervous system. Trauma, including spinal cord injuries, may also result in neurological impairment. Vascular causes, such as stroke, are common culprits behind sudden neurological deficits. Degenerative conditions like Parkinson's disease and Alzheimer's lead to gradual neural deterioration. Autoimmune disorders, such as multiple sclerosis and Guillain-Barré syndrome, occur when the body's immune system attacks its own nervous tissue. Lastly, neoplastic conditions like gliomas can result in brain or spinal tumors that disrupt normal neural function. Diagnosing nervous disorders often involves a combination of advanced diagnostic tools, each helping to provide a clearer picture of the underlying condition. MRI and CT scans are commonly used to visualize brain and spinal abnormalities, such as tumors, lesions, or signs of stroke. For disorders like epilepsy, an electroencephalogram helps detect abnormal electrical activity in the brain. A lumbar puncture, or CSF analysis, can provide valuable information, especially for conditions like multiple sclerosis or infections affecting the brain and spinal cord. Nerve conduction studies are used to assess the function of peripheral nerves, while blood tests can help identify autoimmune markers or infections that may be causing neurological symptoms. Managing nervous disorders involves a multifaceted approach tailored to the specific condition. Medically, patients may be treated with anti-epileptics for seizures, immunosuppressants for autoimmune diseases, antibiotics for infections, or anticoagulants for conditions like stroke. In some cases, surgical intervention may be required, such as tumor removal or shunt placement to alleviate pressure on the brain. Rehabilitation plays a crucial role in recovery, with physiotherapy, occupational therapy, and speech therapy helping patients regain function and improve quality of life. Lastly, psychiatric support is essential for addressing any depression or anxiety that often accompanies neurological conditions. This concludes our general overview of nervous disorders, including their classification, common symptoms, causes, diagnostic tools, and management strategies. In the upcoming modules, we will explore each neurological disorder in detail, discussing their specific features, clinical presentation, diagnosis, and treatment approaches. Stay with us as we delve into each condition individually to build a clearer and deeper understanding.